Decreasing delays to referral for upper extremity reconstruction is particularly important, as one treatment, nerve transfer surgery, is often time-sensitive. The opportunity to undergo surgery is lost as time passes. In this video, we'll explain why nerve transfer surgery can be time-sensitive, what the critical window is, and how early conversations and referrals can avoid missed treatment opportunities. To understand timing, let's look at what happens above, below, and within the zone of spinal cord injury. Above the zone of injury, lower motor neurons are intact. The muscles are strong and under volitional control. These nerves can act as donors for nerve transfer surgery. Below the zone of injury, the lower motor neurons are also intact, but control from the brain is lost due to the injury. The muscles might exhibit spasticity, as they are not under volitional control. These nerves can act as recipients for nerve transfer surgery even years after injury. Now let's talk about the zone of injury itself. Here, the lower motor neurons are often damaged, and that's where the timing of nerve transfer surgery becomes critical. When a muscle loses its nerve input, it starts to deteriorate. Over time, it undergoes fibrosis and motor end plate degeneration. Within 12 to 18 months, the muscle becomes non-responsive, even if a nerve transfer surgery is done. Why the rush? Because donor nerves grow slowly, about 1 millimeter per day, or 1 inch per month from the site of nerve transfer to the recipient muscle. So, if you wait too long, the transferred nerve won't reach the recipient muscle before it's too late. That's why we call these time-sensitive nerve transfers. There's a window of opportunity, and once it closes, that muscle movement cannot be restored using nerve transfer surgery. How common is this? According to data from the European Multi-Center Study about Spinal Cord Injury, EMSCI, nerve transfer surgery is usually time-sensitive for the majority of individuals, 30 to 80%. Fewer than 20% are considered non-time sensitive for this procedure. Let's look at the course of events after spinal cord injury. We know that there is natural recovery that can happen. However, most of that recovery happens early after injury, slows by 6 months, and will eventually plateau. In fact, only 10% of people with no hand movement at 6 months get this back at 12 months with natural recovery alone, based on data from EMSCI. Given the high prevalence of time-sensitive nerve transfer opportunities, we recommend that individuals with cervical spinal cord injury undergo early evaluation between 3 and 6 months after injury. If nerve transfer surgery is time-sensitive and the individual is interested, we recommend surgery be done around 6 months after injury. This balances monitoring for natural recovery with giving the nerves time to regenerate and prevent recipient muscle degeneration after surgery. By starting the conversation about the upper extremity early, you help ensure that time-sensitive nerve transfer opportunities are not missed. People with SCI are given access to the full range of treatments, and decisions are made while options are still available. Even if you're unsure whether someone is a candidate, an early conversation and referral allows the surgical team to evaluate and manage next steps. Your role is crucial in helping individuals with SCI explore all their options while they still have them.